Hi guys, and welcome back to my channel. Today we'll be going through some practice questions and answers for nursing instruments. We'll start right off with question 1. While inserting a Foley catheter, the nurse finds that the balloon fails to inflate. Which is the most likely cause? A. The catheter is inserted too deeply. B. The inflation port is blocked or defective. C. The wrong catheter size was chosen. D. The urine bag is positioned too low. In option A, inserting the catheter too far will not prevent inflation. The balloon will still inflate, but possibly inside the urethra or beyond the bladder neck, and this can cause injury or discomfort. If the balloon of a Foley catheter fails to inflate, the most likely cause is a blocked or defective inflation port or channel, because this will prevent sterile water from reaching the balloon. In option C, using an incorrect size of catheter may cause leakage or trauma, but it wouldn't directly cause the balloon not to inflate. And in option D, the position of the urine bag affects drainage but not the balloon inflation. So the correct answer here would be option B. A key tip to take note of is that before insertion, you should always test the balloon for integrity by inflating it with sterile water, then deflating it completely to ensure that the system works perfectly. So first of all, do not force the syringe. Forcing it can rupture the balloon or even cause other damage. Question 2. During dressing, a nurse uses a long-handled instrument with blunt ends to pick up sterile gauze without touching it. Identify the instrument from these options. A. Artery forceps. B. Dressing scissors. C. Thumb forceps. D. Sponge holding forceps. An artery forceps is used to clamp blood vessels in order to control bleeding, but it is not used for holding sponges. A dressing scissors is designed to cut bandages or dressings, but not for picking up sterile gauze. Thumb forceps are shorter and they are typically used for grasping tissues during minor procedures. However, it is not ideal for maintaining sterility over distance. Sponge holding forceps are long-handled instruments that have blunt, serrated ends, and they are designed to hold sterile sponges or gauze during dressing changes or during surgical procedures. So they actually allow the nurse to handle sterile materials without contaminating them. So our answer here is option D. A key tip is to always hold the sponge holding forceps above the waist level and below the shoulder height in order to maintain sterility, especially during dressing procedures. Question 3. While assisting in cardiac surgery, the nurse observes a device that cools and rewarms the patient's blood during bypass. Identify this equipment. A. Defibrillator. B. Heart-lung machine. C. Dialysis machine. D. Ventilator. A defibrillator delivers electric shocks to restore normal heart rhythm during cardiac arrest. It, however, does not handle blood flow or temperature control. The heart-lung machine temporarily takes over the function of the heart and lungs during cardiac surgery. What it does is that it oxygenates the blood, circulates it through the body, and it can also cool and rewarm the patient's blood in order to protect the organs and manage body temperature during surgery. In option C, dialysis machine filters waste and excess fluid from the blood when the kidneys fail. This is, however, not used in cardiac surgery. A ventilator supports or replaces breathing by moving air in and out of the lungs, but it doesn't circulate or cool blood. So the equipment from the scenario we have in the question will be option B. The heart-lung machine is the device that cools and rewarms the patient's blood during bypass. Question 4. What instrument is used to measure oxygen saturation in the blood? A. Pulse oximeter. B. Glucometer. C. Stethoscope. D. Thermometer. A pulse oximeter is a non-invasive device that is used to measure the oxygen saturation level in the blood as well as the pulse rates. A glucometer measures blood glucose levels but not oxygen saturation. A stethoscope is used to listen to the heart, lung, and bowel sounds, but it's not for measuring oxygen level. And a thermometer measures body temperature. So, out of the options, the one that measures oxygen saturation in the body, in the blood, is the pulse oximeter. It typically clips onto a patient's finger, their toe, or their earlobe, and it uses light sensors to detect how much oxygen is carried by hemoglobin in the blood. Question 5. During oxygen administration via nasal cannula, the patient complains of dryness in the nose and throat. What equipment adjustment should the nurse consider? A. Decrease oxygen flow rates. B. Use a humidifier bottle attached to the oxygen source. C. Switch to a simple face mask. D. Apply petroleum jelly around the nostrils. Actioning option A may reduce dryness, but it could compromise the oxygen delivery if the patient needs a specific flow rate. Dryness in the nose and throat is a common side effect of low-flow oxygen therapy via the nasal cannula, especially at higher flow rates. So, using a humidifier bottle adds moisture to the oxygen, and this goes ahead to prevent irritation and also improves the patient's comfort. In option C, switching to a simple face mask will provide a higher oxygen concentration, but it does not address the dryness that the patient has complained about. And in option D, petroleum jelly is not recommended as it is highly flammable and it is unsafe with oxygen therapy. So the best equipment adjustments would be option B, using a humidifier bottle that is attached to the oxygen source. Question 6. When using a digital blood pressure monitor on a patient with tremors, what is the most accurate alternative? A. Wrist BP monitor. B. Pulse oximeter estimation. C. Manual sphygmomanometer with stethoscope. D. Automated upper arm cuff with smaller size. Tremors can cause digital or automated blood pressure monitors to give inaccurate readings because the machine may misinterpret the vibrations as pulse signals. So, in order to counteract this, using a manual sphygmomanometer with a stethoscope will allow the nurse to listen directly to the correct sounds, thereby providing a more reliable measurement. In option A, a wrist BP monitor is even more sensitive to movement, so tremors may actually worsen the accuracy. A pulse oximeter estimation cannot measure blood pressure. It only measures the oxygen saturation and pulse. I've already explained option C. So using a manual sphygmomanometer with a stethoscope will give a more reliable measurement. In option D, cuff size alone does not correct for errors caused by patient tremor. So of these options, the most accurate alternative is option C. When patients have movement disorders such as tremors or arrhythmias, it is always preferable to use a manual method for accurate blood pressure measurements, and this is by using that manual sphygmomanometer with a stethoscope. Question 7. As a nurse setting up a chest drainage system after thoracic surgery, which chamber should bubble gently during exhalation? A. Collection chamber. B. Water seal chamber. C. Suction control chamber. D. Drainage outlets. A collection chamber collects fluid that is drained from the pleural space, so it should not bubble. In a chest drainage system, the water seal chamber acts as a one-way valve, allowing air to exit the pleural space but preventing that air from re-entering. So, the gentle bubbling in this chamber during exhalation, coughing, or forced expiration indicates that the air is being properly expelled from the pleural cavity. In option C, the suction control chamber regulates suction pressure. If there is a continuous gentle bubbling here, it is normal only when the suction is applied. It does not indicate exhalation airflow. The drainage outlet is the pathway for fluid to leave. It is not a chamber for observing bubbling. So our answer here, the correct chamber would be option B, the water seal chamber. Now, a point to note is that if there is continuous vigorous bubbling in the water seal, it may indicate an air leak, whereas if there is no bubbling at all, it could mean that the system is obstructed or that the lung has re-expanded. So it is important to always monitor the rise and fall of fluid with respiration, along with bubbling for proper system function. Question 8. What is the primary use of a sphygmomanometer? A. Measuring blood sugar. B. Measuring oxygen levels. C. Measuring heart rates. D. Measuring blood pressure. A glucometer is used for measuring blood sugar. A pulse oximeter is used for measuring oxygen levels in the blood. Measuring heart rate can be done manually via checking of the pulse or with a heart monitor, while a sphygmomanometer is a device that has been specifically designed to measure blood pressure. It consists of an inflatable cuff, which is placed around the patient's arm, a stethoscope for manually taking the readings, and a pressure gauge, which can be aneroid or mercury. So the primary use of a sphygmomanometer is to measure blood pressure. Question 9. Which nursing equipment must be tested for correct function before assisting with endotracheal intubation? A. Ambu bag. B. Nebulizer. C. Venturi mask. D. Incentive spirometer. Before endotracheal intubation, the nurse must ensure that the ambu bag is functional. The ambu bag is a device that is used to manually ventilate the patient if oxygenation is inadequate during or after intubation. So, testing it beforehand will ensure that the valves are working correctly and that there are no leaks in the system, and that the bag also inflates and deflates properly. A nebulizer is used for medication delivery via inhalation, but it is not required during intubation. A venturi mask provides controlled oxygen concentration for patients that are breathing spontaneously. However, it is irrelevant during intubation. An incentive spirometer is used for post-operative lung exercises, but it is not related to airway management. So, out of these options, the correct one would be option A. The Ambu bag or the resuscitation bag is used to manually ventilate a patient if oxygenation is inadequate during or after intubation. Question 10. A nurse sets up an infusion with a cylindrical transparent drip chamber that counts drops easily. Which components from these options does this describe? A. Burette chamber. B. Roller clamp. C. Drip chamber. D. Air vent. A burette chamber is a small volume chamber that is used for precise medication administration, and it is often used in pediatrics. A roller clamp is a device that is used to adjust or stop the flow of IV fluid, but it does not hold or display the drops of the fluid. The drip chamber is a cylindrical transparent part of an IV infusion set that allows the nurse to see and count drops in order to regulate the flow rates. It also helps to maintain a steady infusion rate as well as preventing air bubbles from entering the IV tubing. The air vent allows air to enter or escape from the fluid container, but it cannot be used to observe drops. So the components described in our question is option C, the drip chamber. A quick tip is to always fill the drip chamber about halfway before starting an infusion in order to prevent an air embolism while allowing easy monitoring of the drop rates. Question 11. During a surgical procedure, the nurse uses a bear hugger system. Its main purpose is to A. Control bleeding during surgery. B. Deliver anesthesia gases. C. Maintain sterile airflow. D. Warm the patient using forced air technology. In option A, controlling bleeding during surgery is achieved with instruments like the hemostats, not a warming system. In option B, delivering anesthesia gases is done by anesthesia machines. In option C, maintaining a sterile airflow is achieved by laminar airflow systems in the operating room. And in option D, just a brief explanation, the bear hugger system is a patient warming device that uses forced warm air to maintain the patient's body temperature during surgery. This helps to prevent hypothermia, which can reduce complications such as infection risk, delayed recovery, and increased bleeding. So our answer here is option D. The bear hugger system is used to warm the patient using forced air technology in order to prevent hypothermia. Question 12. A nurse preparing to perform a capillary blood glucose test notices that the glucometer displays an error after inserting a new test strip. What should the nurse do first? A. Turn off the device and retry immediately. B. Clean the test strip ports with alcohol. C. Check the test strip's expiry date and calibration code. D. Perform the test on another patient. Option A may not solve the problem if the test strip is defective. Option B is only necessary if there is dirt or debris visibly present, but this shouldn't even be the first step. If a glucometer shows an error after inserting a new test strip, the most likely cause is a problem with the strip itself. So it could be that the strip has expired or it is missing a calibration code. So the first thing to do is always check the expiration date and calibration code of the test strip before use. So that's why we'll be going with option C. Using an expired or improperly coded strip can give false blood glucose reading, and this would affect the patient's care. Question 13. What is a laryngoscope primarily used for? A. Removing tonsils. B. Intubation. C. Viewing the lungs. D. Examining the throat. Option A. Removing the tonsils is done with specialized surgical tools, but not a laryngoscope. A laryngoscope is a medical instrument that is used to visualize the vocal cords and larynx during endotracheal intubation. It helps the clinician to guide the endotracheal tube into the trachea safely and efficiently. Option C is achieved with a bronchoscope or imaging techniques like an X-ray or a CT. While option D, in order to examine the throat, a tongue depressor and light source are usually sufficient. A laryngoscope would not be necessary to use during throat examination. So, the primary use of a laryngoscope is for intubation, and that is option B. Question 14. Which tool is used to sterilize surgical instruments? A. Nebulizer. B. Centrifuge. C. Autoclave. D. Incubator. A nebulizer delivers aerosolized medication to the lungs. It is not used for sterilization. A centrifuge separates substances of different densities in a sample. It is not used for sterilizing instruments. An autoclave is a device that sterilizes surgical instruments and other medical instruments using high-pressure saturated steam at very high temperatures. By doing this, it effectively kills bacteria, viruses, fungi, and spores, and it ensures that the instruments are safe for use in sterile procedures. An incubator maintains controlled environmental conditions, and this is often used for growing microbial cultures, but it does not sterilize equipment. So the correct answer here is option C, and I've put in a screenshot of what an autoclave can look like. Question 15. Which equipment is essential when transferring a non-ambulatory patient from a bed to a wheelchair safely? A. Walker. B. Gait belt. C. Sliding board. D. Hydraulic lift. A walker assists patients who can walk with support, but this is not suitable for non-ambulatory patients. A gait belt is used to assist patients who can partially bear weight, but it is insufficient for fully non-ambulatory patients. A sliding board is helpful for patients with some upper body strength, but it is not ideal for non-ambulatory patients. A hydraulic lift is essential for safely transferring non-ambulatory or even heavy patients from a bed to a wheelchair. By using this, it minimizes the risk of injury to both the nurse and the patient by providing mechanical support during the transfer. So our answer here is option D. Question 16. While preparing an autoclave for use, the nurse notices the indicator tape has not changed color after the cycle. What should be done? A. Reuse the instruments since cycle time completed. B. Reset the timer and repeat the process. C. Consider the instruments unsterile and re-autoclave. D. Use a chemical disinfectant instead. Option A is unsafe because the cycle may not have reached the correct sterilization parameters. Option B, simply resetting without verifying the autoclave function may still fail, so proper inspection is required. An autoclave indicator tape changes color when the proper temperature and pressure are reached during sterilization. So if the tape does not change color, it clearly indicates that the cycle was ineffective and the instruments cannot be considered to be sterile. In option D, disinfection is not equivalent to sterilization for surgical instruments. So the correct answer here would be option C. As long as the tape has not changed color after the cycle, it is better to consider that those instruments are unsterile and the nurse has to re-autoclave. Question 17. The instrument has a circular frame with two flat glass plates that compress breast tissue during an imaging test. Identify it from these options. A. Mammography machine. B. Ultrasound transducer. C. X-ray cassette. D. CT scanner headpiece. A mammography machine is designed for breast imaging using low-dose X-rays. That circular frame with two flat glass plates, which are also known as compressor plates, they gently compress the breast tissue in order to reduce the tissue thickness for better image quality. It also does it to minimize the radiation exposure and also prevents motion blur during the imaging. An ultrasound transducer uses sound waves for imaging, but it does not compress tissue between plates. In option C, X-ray cassettes hold film or digital detectors, but it is not a device that compresses tissue. And in option D, the CT scanner headpiece is designed for imaging the head or body. It is not specifically for breast tissue. So based on the question, the correct answer is option A, the mammography machine. Question 18. While collecting a midstream urine specimen, the nurse accidentally touches the inside of the sterile specimen cup lid. What should be done? A. Continue collection since the contamination is minimal. B. Replace only the lid. C. Discard the cup and restart collection with a new sterile container. D. Rinse the lid with sterile saline. For this question, we'll be going with option C. Touching the inside of a sterile specimen cup lid contaminates the sample, and this can lead to a false positive result or inaccurate laboratory analysis. The only safe action here is to discard the contaminated cup and to use a new sterile container. As a tip, always handle the specimen cup and lid from the outside only, and instruct the patient carefully for midstream clean catch collection in order to maintain its sterility. Question 19. What is a Foley catheter primarily used for? A. Oxygen administration. B. Urine drainage. C. IV infusion. D. Blood transfusion. Oxygen administration is done through the nasal cannula, a ventilator, or a mask. This is totally unrelated to a Foley catheter. A Foley catheter is an indwelling urinary catheter that is used to drain urine from the bladder continuously. So it consists of a flexible tube with a balloon at the tip that is inflated once inside the bladder in order to hold the catheter in place. An IV infusion requires an intravenous cannula, not a Foley catheter. And blood transfusion is administered through an IV line, not a urinary catheter. So our answer here is option B. The Foley catheter is primarily used for urine drainage. Question 20. A thermometer that provides a reading through the ear is called A. Digital thermometer. B. Infrared thermometer. C. Tympanic thermometer. D. Mercury thermometer. A digital thermometer can measure temperature orally, axillary, or rectally, but not specifically via the ear. An infrared thermometer can measure temperature without contact, and it's usually used on the forehead. A tympanic thermometer measures body temperature through the ear canal by detecting the infrared heat emitted from the tympanic membrane, while a mercury thermometer uses the traditional glass thermometer for oral. So the correct answer here is option C, the tympanic thermometer. This brings us to the end of the practice questions and answers for nursing instruments. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next video will be dropping. Thank you for watching, and I'll see you in the next video.